Most dentists aren't trained in making the appliances. They can take the impressions and take a bite and have an appliance fabricated, but there is a certain protocol that the American Academy of Sleep Medicine has recommended being used. And those dentists that wish to treat their patients properly learn that protocol, and many of them joined the American Academy of Dental Sleep Medicine, which has the same standards, and they actually have a program to certify dentists in sleep medicine, in dental sleep medicine, in being able to treat the sleep apnea.
It's quite amazing, because when I first thought about this, it seemed quite simple to me, but it turns out that it's anything but simple, because everybody's jaw is different from everybody else.
They're different. It's not just the jaws are different, but their airway is different. Before I treat somebody, I'm going to check their airways, both the nasal airway and their oropharyngeal airway. And we have special instruments in the office that are based on the same principles as sonar. And it actually measures the cross-sectional area throughout the airway. And by measuring that and then going through a little test, we can determine where the collapse in the airway is and if the dental appliance will actually help them. So I want to do a test on them before I make an appliance, because there's a certain percentage of individuals that a dental appliance isn't going to help. The airway obstruction may be in an area that the appliance won't help.
Well, they say that no two bodies are alike, and I believe it. But it never dawned on me that it would go that far inside.
It does. And the consequences of sleep apnea are similar to many of the consequences of periodontal disease. There's an increased risk of stroke and heart attack, increased risk for diabetes, snoring, which is a symptom of sleep apnea about 80% of the time, may cause other health problems too. Somebody can simply snore without having sleep apnea, and a study that came out of Australia 2 years ago, in their study they found that the snoring was a risk factor in creating the plaque in carotid atherosclerosis, where the carotid arteries going to the brain get plugged up.
Ah.
And if you are a light snorer, you have a 20% risk. If you're a moderate snorer, you have a 32% risk. And if you're a heavy snorer, you have a 64% risk factor in developing a blockage of your carotid arteries.
In other words, this is something that should be looked at in children, and not a constant eye, but a close eye on what's occurring as they grow up.
Basically all snoring should be treated, whether it's in kids or in adults, and treatment is going to be different. Kids, when they snore, it's maybe a sign of obstruction, but also comes about because of inadequate sleep, and that inadequate sleep affects their grades. Studies have shown that that there's going to be 1 or 2 grade differences. They're the scholastic grade, not the grade that school that they're in, but it's going to be several grades higher if they get adequate sleep. And kids today aren't getting adequate sleep because of television and texting and games and all of this sort of thing.
I have heard that, and I wasn't thinking, I didn't connect it with what you're saying, but yes, that children require a certain amount of rest, and that if they don't get it, their grades do fall.
They definitely do. And during sleep is when our heart rests too. And this is why in adults it becomes important to treat the sleep apnea, because if the heart isn't getting its rest, then with the sleep apnea, it makes any heart condition worse. Because when you stop breathing, your blood oxygen level goes down, and the carbon dioxide level in the blood goes up. Your heart starts beating faster then, and it can actually start racing, and then arrhythmias develop. You can develop a heart attack and die in your sleep from sleep apnea.
This program is sponsored in part by